welcome to 12th Canadian Science Policy Conference, CSPC 2020. I'm Sumedha, and today we have the pleasure of speaking with Dr. Jennifer Leason. Dr. Jennifer Leason is an assistant professor at University of Calgary, where she examines Indigenous maternity experiences from prenatal, labor, and postpartum healthcare. Dr. Leason wears many hats, and she's also an artist. She's also CIHR Chair in Indigenous Maternal Child Wellness. Welcome, Dr. Leason.
Thank you so much for having me.
Thank you. Dr. Leason, you have been involved with Indigenous women initiatives, not only from Canada, but also internationally. You're associated with organizations like ICJUT in India, where you work with women's reproductive health and their experiences of maternity. Can you tell us more about your work and other initiatives you're involved with?
Absolutely, absolutely. I'm just going to begin by actually introducing myself in Anishinaabe, and then maybe I can fill you in on some of our initiatives after that. So, bonjour, ani kizi sagayagada kon Indigenous. Che magwach kachim manado. Che magwach namin wandam mayayan. Chemagwach Sutana, Treaty 7, Métis Region 3. And so I just introduced myself. I'm from Pine Creek First Nations Indian Band in Manitoba. And I'm actually teleconferencing in today from, well, not teleconferencing, zooming in from the Treaty 7 territory. And I currently live in Sutana. So I just want to really acknowledge, the land and the ancestors and the territories of which we all come, and the beautiful, diverse peoples across Canada. And so I'm Anishinaabe, and as you said, I'm a Canada Research Chair in Indigenous Maternal Child Wellness, and I do wear many hats and many different projects, but I guess the main projects that I work on within myself and my own family is language and culture as a determinant of wellness, and using Indigenous storytelling and art and culture as a means of building resiliency. And I'm currently working on different projects, including developing curriculum here at the University of Calgary on Indigenous and decolonized methodologies and incorporating Indigenous perspectives into our courses throughout campus. So that's an exciting initiative. I'm also involved in various mentorship opportunities and giving mentorship to high school students, as well as our graduate students and undergrads through the Alberta Indigenous Mentorship and Health Innovation, which is a CHR grant. And I work for many different communities, but one of the communities that I work with is the Secwepemc Nation in British Columbia, and supporting their injury surveillance and prevention programs. Also working with the First Nations Health Authority in BC on cultural safety. I've worked with the Public Health Agency of Canada in the past on alcohol and acute toxicity deaths in Canada. And the most recent projects is really examining Indigenous maternity experiences. And this research is in partnership with the Native Women's Association of Canada. And I'm happy to share that some of that work has kind of evolved to include assessing the economic impacts of obstetric evacuation for First Nations and Inuit women, and examining the social cultural benefits of Indigenous midwifery. So I have the privilege of working with amazing Indigenous leaders and women and mothers and Indigenous midwives, such as the National Aboriginal Council of Midwives, the Haktitit Inuit Women's Association, and various community partners and elders. And I'm just so grateful. I'm so grateful for the work I do. Every day is a blessing.
Thank you so much, Dr. Leason. That was wonderful. Congratulations for all the work you are doing.
It's a lot, but I can't help but feel inspired by all the amazing people and the good work that everyone is doing.
Thank you for the amazing work you are doing. So, Dr. Leason, when we talk about equity, diversity, and inclusion in workplaces, that starts actually with more women or more female candidates going to the university for higher education. So we already see it's very unfortunate that if we see the female candidates going to, the number of female candidates going to university or higher education is very less than their male counterparts. And that's even worse for Indigenous women or female candidates. What do you think, what are the gaps in the policies, and how can we ensure more Indigenous female candidates going for for higher education, how can we encourage them, or maybe like how can we include more of them?
Absolutely. It's a really complex question, and but I'll do my best to keep it short and keep it brief. And so I think you really touched on an important conversation around equity, diversity, and inclusion in higher education, because as we know, 64% of the non-Indigenous population have a university degree compared to 9.8%. So that's relatively a sixth of the population are kind of going on to higher education. And so, we do have a lot of work to do in terms of alleviating that education disparity and inequity. But I think this really starts at, a community level, as well as, supporting our high school students, right? So it's this idea of intergenerational mentorship and ensuring that our youth are completing high school, because it's, I think the stat is around 68% of our youth have a high school diploma compared to, 90% of our Canadian population. In terms of, Indigenous women with a university degree, I think it's about, I'm going to say 13.6%. So these are some of the stats I'm pulling out from the National Household Survey of 2011. And so, but this varies, right? So this varies when I don't want to use kind of this broad stroke of Indigenous women, because it varies among our First Nations, our Métis and Inuit populations. For example, high school completion is 60% for First Nations, 73% for Métis, and 41% for our Inuit, brothers and sisters. And so we really need to think and reflect on the diversity of our communities, but also the diverse contexts in which they live. And so at the university, I know we're all working hard within some of our EDI initiatives across the university, but the reality is that only 1% of Indigenous post-secondary professors are Indigenous. There's 1% of us in the academy. So
yeah, that's negligible.
It's a little bit overwhelming to be one of those 1%. I get called upon a lot, and so we need to make sure that we're supporting our EDI inclusions and making sure that we're not kind of overloading and overburdening, some of our Black and Indigenous scholars. But I think that it's a great momentum, and I'm really appreciative of the commitment to EDI, ensuring that Indigenous ways of knowing, Indigenous ways of being and doing are being integrated into all sectors of our campuses, including, curriculum and leadership and administration, and specifically research. But in terms of including and encouraging Indigenous women and Indigenous men, and our LGBTQ2 and our gender diverse peoples in higher education, as I said, it's complex, it's diverse, it's multifactorial, and I think there's two things that need to be done. One is to understand kind of Indigenous perspectives of holistic needs or holistic learning. And the other two, which I mentioned, or the second one, is to also understand the context in which Indigenous people and youth are living in. And so when I speak about holistic needs of learning, it's that, we assume that learning is done in textbooks and in the halls of the university. But when we take an Indigenous perspective about knowledge and what is knowledge, knowledge is more of a holistic dimensions of not only this, mental aspects of learning, but that it's also an emotional learning. It's a spiritual learning. It's a physical learning. It's about learning as a lifelong journey, because knowledge is inherent in all things, and not just textbooks and universities, but I think about all of our elders and our knowledge keepers who have this incredible, rich knowledge of traditional knowledge systems and the languages and the ceremonies, and thinking about our first teachers, the land and connection to place. And so I think that our systems and our policies and our practices really need to open our minds to multiple ways of being in this world. But in terms of context and understanding context, I think we have a long ways to go. As I said, our high school completion rates are lower, and, we have a lot of work to do. But I think it's about really addressing the underlying social determinants of education. And these underlying determinants include things that are access to basic human rights and necessities. And being access to clean drinking water. We have 60% of our communities on boil water advisories. Access to safe, affordable, accessible, and sustainable housing. When you're constantly worrying about basic necessities, it's hard to concentrate, on finishing something when there's barriers in the way. And the same is true for food security, food sovereignty, and early childhood. But ultimately, I think it's about addressing healthy life trajectories and providing opportunities and mentorship and training, and really addressing the infrastructure needs and the gaps to ensure that there's economic equality and investment in education. But lastly, I think that it's ultimately about addressing barriers to education. And I think that if the Truth and Reconciliation Commission or the United Nations Declaration of Rights of Indigenous Peoples, or even the recent death of Joyce Echaquan, is that as a country and as a community and as an institution of higher learning, I think it's about addressing the structural inequities, policies, and practices, including structures of racism, to making sure that we are creating safe spaces. And not only safe spaces, but spaces in which people can thrive. And this is true not only in healthcare and justice and social services, but also includes education. So I hope that wasn't too much of an answer, but it's so complex. It's so complex.
Yeah. Thank you, Dr. Leason, for sharing your views. That was beautiful. You are actually an inspiration to many for the work you are doing for the community. Thank you so much. So as you mentioned that we actually lack the basic infrastructure. So coming to COVID, so this year had been challenging for everyone, but what Indigenous communities were fighting was the basic access to PPE, basic testing centers. There are none. And this actually shows the underfunding of healthcare and associated infrastructure in the healthcare in Indigenous communities, and which severely limit their capacity to fight diseases like COVID. So, and you're also a panelist at CSPC conference this year, where you'll be talking about COVID-19 and global Indigenous health equity, holistic life cycles approach to systems change. What do you think are the key challenges, and what can we do to ensure the well-being and safety of the women, especially, and the mothers, when there is in one way there are no healthcare facilities available, and plus with that COVID quarantine brings in sexual violence and domestic abuse. What do you think from a policy perspective we can do to ensure well-being and safety of our women and mothers?
Again, another big question. You didn't make this easy for me, did you? I was listening to the Indigenous Services Minister, Mark Miller, and the Chief Medical Officer of Dr. Tom Wong, as well as the Indigenous Services ADM, Dr. Valerie Gideon, yesterday, and they were saying how, within the First Nations communities that there were, I think, 768 confirmed cases, 123 active and 13 deaths, but 623 recovered. That's solely on reserve. And I think one of the challenges that we have, again, not to broad paint, Indigenous, because as I was saying, the diversity of our First Nations, Métis and Inuit, the complexity of, identity, as well as, First Nations on reserve versus off reserve, status First Nations, non-status, Inuit. It's part of the challenge is that, our communities are advocating for data sovereignty. And unfortunately, these are the stats through the Indigenous Services for First Nations on reserve, but there's so many different data limitations, and that, it's difficult to capture specific numbers for, our Métis, our Inuit, and our urban Indigenous brothers and sisters that live in urban centers. And so, with some of those data limitations, sometimes it's hard to capture and keep track. But in terms of, the barriers or the gaps and things that are happening within communities, it's obviously important to understand some of the challenges that are related to, again, I think the social and structural determinants that I spoke to in my previous answer, is that really it's about addressing those underlying social determinants and ensuring that there's access to those resources and supports that were needed. And, I think there were, testing limitations, but at the same time, I do want to say that while watching, social media or being engaged in different community events, I just want to commend our communities for the amazing work that they did do in stopping and keeping the numbers as low as they did. Because, in my experience in our communities and watching the Assembly of First Nations or the Métis National Council at national and provincial levels and the Natsiavut government and, even the individual bands and nations and the amazing Indigenous community-based organizations and our frontline healthcare workers and our Indigenous First Nations Métis Inuit health directors, I just really saw this amazing collective front to really protect people and protect our people, particularly, the elders and those that were immunocompromised. And, I saw everything from, elders sewing face masks and, getting them out, and these amazing, food drives, and a call for, hunting and distributing traditional foods and collecting medicines. And, it was a summer of online powwows and Zoom sewing and beading groups. And, but in terms of, supporting women and mothers, particularly women with single parenting or, impacted by employment or, as you mentioned, some of the violence that's occurring is again, I really saw Indigenous women and Indigenous leaders and leadership really kind of step up and, ensure the safety of our people, both at a physical level and throughout COVID. But I think about, again, my partnership with the National Aboriginal Council of Midwives and this collective group of amazing women that supported women to birth in place to make sure that they weren't, exposed. Or the other amazing work is some of our women's shelters across this country, and specifically here in Calgary, the amazing work of Awatan and the director Josie Niepanak and Elder Jackie Bromley. And so these women and these leaders that really stepped up to make sure that, as I said, just to keep those numbers down and to keep people safe.
Thank you, Dr. Leason. Thank you for telling us the initiatives the communities are taking to make sure everyone is safe and well. So we are actually looking forward to see you at the conference. But this year is a very special year, and CSPC is going virtual, and it is actually an opportunity to reach like more people than ever before. So what are you most looking forward to the conference?
Obviously I'm looking forward to participating in the conference and providing an Indigenous perspective. And I'm not sure, I don't know if CSPC has had, many Indigenous presenters or how many presenters you will have this year, but it's such an honor to be part of your conference. And I think about, science and, an Indigenous perspective to science and all the amazing Indigenous scientists and thinkers and philosophers that I've been inspired by, like, Dr. Jeanette Armstrong and Dr. Leroy Littlebear and Dr. Gregory Kahete. And it's just this, so it's exciting to share some of our kind of perspectives about, Indigenous science and policy. But I think what I'm most excited about is presenting with our amazing panel. And so I have the privilege of presenting with four other amazing people that have really shaped who I am. And so the first is the Honorable Lillian Dick. And so she is a former senator. She's from Cree Gordon First Nations in Saskatchewan. And she is this remarkable person who has had a Lifetime Achievement Award and has been recognized by one of our leaders through Inspire. And she's really inspired me. She's one of the first Indigenous women to pursue a career in science. And she was a neuroscientist at the University of Saskatchewan. And it's actually where I went and did my undergrad in neuropsychology from U of S. And so I've actually never met her. in person. So I'm so excited because she was this woman that I aspired to be and wanted to follow in her footsteps. And, you know, when I talk about the importance of mentorship, is like, she was that person that, you know, I just wanted to follow in her footsteps, follow in her moccasins, and to work on, you know, such things such as missing and murdered Indigenous women. While in Senate from 2005, you know, she was this amazing kind of Indigenous feminist, you know, taking on different bills such as Bill C-31, Bill S-3. She was a huge advocate for mental health and Indigenous education, and really helped to pave the way. And she paved the way for another amazing one of our panelists, which is, her name is Dr. Carrie Barassa. And Carrie is a professor in community health sciences and epidemiology, again at the U of S. So shout out to U of S. I'm from University of Calgary, but I'm just saying anyway. So Carrie is the scientific director of CIHR in our Institute of Indigenous Peoples Health, and has been this fierce leader again to advocate and advance the health and well-being of our First Nations, Métis, and Inuit people across this country. And you know, when I was doing my PhD, there was an article that she published. It was called Racism, Sexism, and Colonialism. And, you know, it really spoke to me in understanding the impacts of those, especially colonialism and the lived experiences of women and how that shapes Indigenous women's health. And so she was also the external on my PhD. So she kind of put me through the ringer, so to speak. But I think it's, again, just this kind of show of this beautiful intergenerational mentorship panel that we'll have at the conference. And the sole male in our panel is Dr. Mike Lickers, and he's an associate faculty at the Royal Roads and a senior advisor with Suncor. And he has dedicated his life and career to advancing Indigenous youth leadership development through land-based and culture and elders and through outdoor education. And I honestly would not be where I am today without him. I was actually one of his interns back in 2006 through Ghost River Rediscovery. And it was because of him that actually I went to Ekjut and worked in India, because I was an intern through Ghost River Rediscovery with CETA. And it was this beautiful journey of, you know, rediscovering and reclaiming and resurging my own identity. But he also taught me the importance of, you know, meaningful and engaged and grounded intergenerational mentorship, which is our last panel member, Shelley Wyatt. And so Shelley, this panel would not be possible without her. She makes things happen. And so she was the one that actually put in the proposal. And she's just this amazing Métis woman and scholar and leader. And she just has this beautiful ability of, you know, seeing the strengths within everyone and bringing everyone together. And her energy and her smile is contagious. And so Shelley's the leader of and founder of Women Warriors. And I'm just always so inspired by her beautiful grassroots movements and, you know, celebrating Indigenous women's health and strength. And so she's absolutely a force to be reckoned with. So it's going to be an amazing panel. I really hope that everyone comes to join us and come see what we have to say.
Thank you so much, Dr. Leason. I'm so excited to be at the conference to listen to all the amazing people you just mentioned. So do you have any closing remarks, or do you want to share anything, any unique initiatives you're working on, or where can we go and find about your initiatives and you?
Absolutely. I just want to close by saying, it's just to say thank you to everyone for coming to this exact moment in time. I don't have time to go through what it means, but I just want to thank everyone for you know, coming and sharing with us. And I would strongly encourage, you know, the viewers and attendees to keep learning from Indigenous perspectives in science, and, you know, using those knowledges and experiences and voices from Indigenous communities to help inform policy, because ultimately that's what reconciliation is really about. And there's a lot of great work happening out there. Please check out my website. I'm at jenniferleason.com. Shelley has an amazing website at womenwarriors.com. Dr. Brasa has an amazing website at Morningstar Lodge. And I think it's www.morningstarlodge.com. And of course, come check out the University of Calgary. I'd love to hear from you and look forward to seeing you there.
Thank you so much, Dr. Leason. Thank you so much for sharing your views, and congratulations again for the initiatives you're taking for the work you are doing for the community. Thank you so much. Thank you.
Thank you.